John Snow was a British physician who was considered one of the founders of epidemiology for his work identifying the source of a cholera outbreak in 1854. Born into a laborer's family on March 15, 1813 in York, England, John, at the age of 14, was apprenticed to a surgeon. In 1836, he moved to London to start his formal medical education. He became a member of the Royal College of Surgeons in 1838 and graduated from the University of London in 1844. 6 years later, he was admitted to the Royal College of Physicians in 1850. Working as an obstetrician in his early years, he had a great interest in many aspects of medical science. During this time, the first cases of a cholera outbreak were reported in England. In the middle 1800s, people didn't have running water or modern toilets in their homes. They used town wells and communal pumps to get the water they used for drinking, cooking, and washing. Septic systems were primitive, and most homes and businesses dumped untreated sewage and animal waste directly into the Thames River or into open pits called cesspools. Water companies often bottled from the Thames and delivered it to pubs, breweries, and other businesses. Unlike popular beliefs and to many of his colleagues' educated assumptions that cholera was airborne, he did not accept this miasma or bad air theory to be the root of such an illness. Moreover, he pursued his own theory that it in fact entered the body through the mouth. At the age of 35, he published an article outlining his theory, but doctors and scientists dashed it to the wind under the pretext that he was young and naive with plenty to learn, urging people to stick with the popular belief that cholera was indeed an airborne issue. Later, Snow was able to prove his theory in dramatic circumstances. In August of 1854, Soho, a suburb of London, was hit hard by a terrible outbreak of cholera. John Snow himself lived near Soho and immediately went to work to prove his theory that contaminated water was the cause of the outbreak. According to Snow's records, the keeper of one coffee shop in the neighborhood, who served glasses of water from the Broad Street pump along with meals, said she knew of 9 of her customers who had contracted cholera. After careful investigation, including plotting cases of cholera on a map of the area, Snow was able to identify a water pump in Broad Street, now known as Broderick Street, London, as the source of the disease. Besides those who lived near the pump, Snow tracked hundreds of cases of cholera to nearby schools, restaurants, businesses, and pubs. He had the handle of the pump removed immediately as to shut down the water pump. In the act of preventing people from access to this source of drinking water, cases of cholera immediately began to diminish. Unfortunately, Snow's germ theory was not widely accepted until the 1860s, after his death from a stroke on the 16th of June, 1858. Today, scientists consider John Snow to be the pioneer of public health research in the field of epidemiology. Most, and close to all, of the current epidemiological research done at the United States CDC, also known as the Centers for Disease Control, still use Dr. Snow's theories and records to track the sources and causes of outbreaks of many diseases that occur today.